Let's talk. Katulabile Paul. Natulande. Let's talk about you and me. Let's talk about all the good things. Talk about things that make me. Let's talk about
It's Tikambe and Natulande, your number one sexual reproductive health show. As usual, we bring to you nothing but the educative best.
Tikambe looks at breaking those cultural barriers, getting young people to talk freely, getting young people to talk to other young people on sexual and reproductive health. It's about getting the conversation started and giving young people access to accurate information that will help them to make better and informed decisions.
I go out there to talk to other young people in the community to say, this is our right, this is our sexual and reproductive health rights, this is what we need to do as young people. When a young person hears from me as a young person, they will have more confidence to talk about it, to have a dialogue about it, meaning that person will say, okay, if a young person can talk to me, I think I can voice out as well. I can talk to this person, I can talk to my parents about this and that, I can acquire more information about it.
251961 is the number you're calling us on.
Menstrual and pregnancy.
So you'd be thinking maybe I'm pregnant. Yes, that's what I thought of.
This is a program that has created that platform for us young people to, join in the fight and freely express our views without being criticized.
Before Tikambe, there was that insecurity. Is she going through what I'm going through? Is she doing what I'm doing? And now it's like, okay, this is normal.
I've featured on Tikambe program twice, and some people would call in, others would text me on Facebook and say, you're very inspiring. We didn't know someone living with HIV can actually come out. It has really helped us understand a lot about HIV or sexual reproductive health. It's just created that platform where we youths can be ourselves.
Now imagine a young person who's listening and they hear from this person explaining her experience and the anguish that she's gone through. So they've got huge positive impact because it's coming from the person who's out there, and these are things that they go through in real life.
It's not just producing a program for the sake of filling up the space. It's a program that has drivers of change and a program that has the behavioral objectives. We need certain skills to ensure that you produce this program to that standard. We start helping them to gain the skills and how to ensure that they get better in all those areas that they are lacking. Because if you don't employ all these things, the program may end up being judgmental, the program may not be as factual as it should be, the program may even be boring.
So we've learned how to make the show more entertaining for the young people as well as educate them at the same time. So the mentoring definitely helps us to improve every day.
How to edit, script, produce, and conduct an interview.
What I'm beginning to see is people are starting to think of other genres where they can apply what they've learned. Some of the producers and the presenters say, oh, why don't we do it this way? And you can tell that this is because they've received extra training from the Tikambe project.
It's beneficial not only for the radio station, but for individuals as well. You get to build on your personal capabilities.
What these young people have been learning about is what you learn when you go to a journalism school. And the huge impact that I have 3 of my CJs, after being with me for the past 6 months, they're thinking of pursuing a journalism course because of what we've learned.
After airing that program, there is what we call a listener group meeting to find out whether that program was really impacted on the young people themselves. The feedback they give us helps us to understand where we can improve the delivery of the program and what needs to be done better.
There are certain topics that we can't talk with our parents or elderly people, but here it's like, hey, this is me, I just have to talk, and it really helps. It educates us more about our sexual reproductive health and how we're supposed to keep ourselves healthy. I go to the clinic and I'm able to express myself, what I'm feeling, the kind of help that I need, the type of person that I need to talk to.
We have trained 70 volunteers that have been placed in 30 schools across 3 provinces. We're reaching out almost close to 16,000 young people within the school setup. Community journalists are transferring skills to the communities for them to be taking the lead. They've been empowered, they have the information, they have the skills to question, to ask the right questions. And that's what the projects have been providing. The process allows the communities, the young people, to be empowered to assess the services that are being provided to them.
Yes, I can say there is an increase of youths coming through to our facilities. to come and ask for information. Some will mention that they heard something on radio, it might be through Tikambe, and then now they want to follow up in our facilities to see if they can be able to really access the services.
Some children are usually
I think the show went really great. I was happy that we had a young person who was actually in what we're talking about. So we had somebody in the studio giving us real information, real life information from a young person.
Radio is very powerful, so whatever you give is taken and treated as gospel truth. So usually, if there are things hanging that we think and feel didn't settle well or go well with the previous program, we make sure that we correct the situation before it's too late.
Thanks a lot, guys.
So whether from a smaller station or a bigger station, we need to ensure that they start speaking the Tikambe language, so that the language is embedded in them. And once it is embedded in them, it is easy for them to bring it out, and the story is told.
The project has saved lives, and a lot of people have learned about health-related issues using the Tikambe project.
We are looking forward a generation that is going to come, which is going to be disease-free, which is going to be knowledgeable, which is going to be able to be free to discuss sexual issues, even maybe with their children when they have them.
We are the future leaders of this nation, and we are the ones to develop this nation. But if we are all going to be destroyed by these STIs, HIV, AIDS, definitely we are destroying the nation. The nation will not develop at all.